Thompson. I am the Director of Operations, and I'm one of the lead injectors within My Face Lady. The purpose of today's video is we're going to be going over some of the fundamentals of toxin training. You're going to dive deeper into this during your live hands-on checkoff training, but the purpose of this is really just so you have an understanding of how toxins work and basic anatomical injection point techniques. So how does it even work? So Botox is an acetylcholine inhibitor. What that means is it blocks the muscle from even firing. So very similar to the lines in your hands, what we tell our patients is the reason why you have those lines, which are called resting stasis, is because of repetitive movement. So if we were to paralyze those muscles over a prolonged period of time, what would happen is you would have that diminishing of those fine lines and wrinkles. And so that is the general outcome that we are trying to achieve with all of neurotoxins. So when you dive into Botox, everyone will metabolize things a little bit differently. And when we say Botox, that's just a general term. There are 4 primary neurotoxins on the market. You have Botox, Dysport, Jeuveau, and Xeomin. And all of them are just a little bit different. During the training, I'm going to dive deeper into how those are different and how you choose the right product for your patient. But on average, per the FDA, all of these neurotoxins will last 3 to 4 months. What I tell all of my patients and what we train all of our injectors to tell our patients is 2 to 3 months. And the reason for that is because the product will start wearing down around 2 months and wearing down around 3 months. So we want to make sure that our patients, we have reasonable expectations of how long that product can truly last in their face. We typically tell all of our patients to get toxins once a quarter, and that will keep your patient looking nice and fresh and get rid of any resting stasis they have. So whenever you are looking at different injection techniques, we divide it into large, medium, and small muscle groups. At the end of the day, what we care about is how much fluid you are pushing into that patient. The amount of units is what you're going to be charging the patient. So on a patient's face, you have 3 different types of muscle groups. You have the large muscle group, which is only the glabella complex. You have the frontalis, the crow's feet, and the mentalis muscle groups. Those are medium. And then you have small muscle groups. With the large muscle group, you will put in 10 fluid units into each injection point. Okay, so 10 inside of all the large ones. For the medium muscle groups, which include the frontalis, the crow's feet, and the mentalis, you're going to be putting in 5 fluid units into each injection point. So it's going to be half. Then you go down to a small muscle group. You're going to divide that number again in half, and it's 2.5. So the small muscle groups consist of an eyebrow lift. You can have a gummy smile. You can you can do the lip flip. You can also do get rid of the little bunny lines on the nose. These are all considered small muscle groups. So in those, each injection point, you would put in 2.5 fluid units into each of those injection points. Okay, so for the frontalis, for the glabella, if I have 5 injection points, this is the only large muscle group on a patient's face. I would do 10 fluid units, 10 fluid units, 10 fluid units, 10 fluid units, and 10. So for this whole area, I'm going to be putting in 10 fluid units. For the frontalis, it is a medium muscle group. So you typically have 7 injection points on a patient's frontalis. You will have that first layer that will consist of 4 points, and then you have this upper layer, which will consist of 3. Unless your patient has a very small forehead, you will typically do these 7 injection points. Because it is a medium muscle group, you're going to be putting in 5 fluid units into each spot. For a normal patient, for 7 spots, you would put in 35 fluid units. Now, when you move to the crow's feet, again, another medium muscle group, a full treatment for the crow's feet is going to be these 3 injections. And medium muscle group, so 5 fluid units, 5 fluid units, 5, and then again on the other side, 5, 5, 5. Now, when you do the small muscle groups, you are going to be doing 2.5. So when you are assessing a patient's glabella, you are trying to get rid of that resting stasis. What you need to understand is whenever you are putting toxin into a patient's face, and once you do paralyze that muscle, the muscle will react a certain way. Either it will elevate or it will depress. The glabella is one of the strongest elevator muscle groups in your face. So when you paralyze this entire complex is going to lift up, which will give that patient that nice, open, refreshed look. The frontalis, on the other hand, is a depressor muscle group. So it's going to pull down when you paralyze it. So what we tell all of our injectors to do, if you are going to be treating that frontalis, please always just do a little bit of injection points in that glabella, even if it's just 1 or 3 injection points, to help hold up that patient's forehead to give them that kind of refreshed look. Whenever you are injecting into the frontalis, what we always tell our patients to do is to lift up their eyebrows. What you're going to be looking for is that first line that goes all the way across. You're going to want to stay about 1/2 centimeter above that line. One way, or one trick that I teach all of my new injectors, is to use the 2-finger rule. And what you're going to do is you place your 2 fingers right at that patient's eyebrow. And you're going to stay right above that. That is going to keep you in that safe zone so you're not causing ptosis and you're not causing that patient's forehead to drop. That is going to be your first injection point. When you are assessing the patient's forehead, what we typically say is your first point is going to be between the pupil and the lateral canthus, and then you're going to go straight up. Again, looking at that first furrow, about 1/2 centimeter up, to double check yourself, your 2-finger rule, and that will make sure that your line is high enough. That is going to be your first point. So that's going to be this one right here. Then the second point is going to be medial. What we say is the medial canthus, and then you're going to go straight up in line with that first dot that you did for that outer first layer. Then the second injection point is going to be, again, that medial canthus. And the second point is going to be medial. What we say is the medial canthus, and then you're going to go straight up in line with that first dot that you did for that outer first layer. Then the second injection point is going to be, again, that medial canthus and then straight up. And then your final injection point for that first layer, again, is going to be between your pupil and your lateral canthus of your eye, straight up. Again, double checking using the 2-finger rule to make sure that you are high enough on the patient's face. For that final layer at the very top, you're going to stagger 3 injection points in between these 2. So you're going to be 1 right at the hairline. The middle one is going to be, again, right at that hairline, and then the last one, that very lateral, will be right at that hairline again. You want to make sure you are creating this beautiful pattern across the patient's forehead to make sure that we are paralyzing all of those muscles. So when that patient does lift up their eyebrows, that they're not having any firing of abnormal muscle. Whenever you are assessing a patient's crow's feet, there is typically, you will do 3 injection points. Now, most of your patients are going to need 3. However, you are going to run into some who just want to do a very light dusting on their crow's feet, or they just want to do something very, very light. But the full treatment for crow's feet is going to be 3 injection points. You want to make sure that you are staying 1 centimeter lateral of that lateral canthus of the eye. And the reason for that is because you don't want to have any of that toxin go underneath the eye where it can paralyze that lower lid. When you blink, you actually blink with your upper and your lower lid. They meet each other a little bit. So what will happen is if you do touch that muscle, it will cause that patient to blink abnormally and also can give the patient some dry eye as well. So your pinky is about 1 centimeter. It's a fantastic ruler. So what I typically do is I am assessing my patient. I put my finger right at that lateral canthus, and then I know I'm in that safe zone. All of the muscles on the crow's feet are going to be at least 1 centimeter out. And that's the goal for the crow's feet, is we want to be paralyzing those muscles that are causing that resting stasis. Now, whenever you are assessing a patient for an eyebrow lift, if a patient is naturally hooded, meaning you don't really see their entire upper lid, you want to make sure that you're going ahead and just adding that eyebrow lift in there. What that's going to do is that's going to keep that patient from becoming even more hooded once that toxin has kicked in, and give them that more opened, relaxed look. Now, what I do for all of my patients is I will stay 1 centimeter medial of that very tip of that eyebrow. What that will do, that will lift that patient's eyebrow up and out and give more of an open eye versus at the very tips where you can actually make the patient look like a cat. Or if you go right to medial and you're going right above where that pupil is, you can give that patient a Spock eye. So we try to stay a little bit more lateral to open up that eye laterally for that more relaxed look. Now, another group that I want to talk about is the bunny lines. So a lot of patients, whenever they frown, what will happen is that procerus muscle, which is part of the glabella complex, you have 2 muscles there. You have your procerus, and then you have the core graders that will kind of branch out. Now, when that procerus is activated, what will happen is it will kind of pull down a little bit prior to being paralyzed, and you will get this horizontal line right at the bridge of the nose, and that will cause a pretty significant resting stasis for your patients. So what we will do is we will knock out that bunny line for them. It is considered a small muscle group, so you will do 2.5 and 2.5 right on either side of that spot to really kind of relax that whole muscle group. You can also have a little riders down that go on the side of the nose. Again, what you're going to do is you're going to have that patient frown or make that kind of bunny face, and then you can see where all of those lines will form. Now, another technique that we tell all of our injectors to do is to always mark your patients. Always mark them while the patient is flexing or has that muscle group activated. What that's going to do is it's going to give you the ability to see exactly where you need to put your injection points. Whenever you are looking at different patients, you're going to notice that whenever they frown, or what I will tell my patients to look pissed, they will really activate that whole glabella complex, so you can really see where those muscles are. Remember, all of your injection points need to be intramuscular, so we want them inside of the muscle. So whenever you are injecting and you are marking, you can know exactly where to put that muscle. When that patient finally does relax, when you go to inject, those dots will move a little bit, and that will keep you right where you're supposed to go, right where that muscle is. The goal of toxins is to give our patients a relaxed look. We never want anyone to look overdone or too frozen. We want them to be happy. We're trying to get rid of that resting stasis. Now, the rules of Botox, every time I inject a patient, I tell them that it will last on average 2 to 3 months. Some patients might get a little bit longer, but if I say on average 2 to 3 months, they're always going to be happy about that. And I will also tell them that they are not allowed to lay down flat for 4 hours and no vigorous exercise for the next 4 hours. I also let them know that we don't want them to get any types of facials for the next 24 hours. The reason for that is we don't want anyone massaging the face to move that product or anything. And then the last rule of thumb is I don't want anyone microblading their eyebrows until that product has completely kicked in. So I typically tell them to wait about 14 days to do any type of microblading to the eyebrows. If a patient does need any touch-ups, we always require that they wait at least 10 days so that product can kick in. So we know if we need to go and do any tweaks after that, it will be after those 10 days. Now, as you go through your injecting career, you are going to see there are so many different techniques all out there, and everyone is going to say this is the correct way to do it. Now, this is one way that MFL has continued through our training program, but as you progress through your career, what you're going to find is that you're going to find what fits you as an injector and then also your patients. So please always feel free to share with us your experiences, the new techniques that you learn, your tricks and tips. Please always let us know. We are always here to support you as an injector, and we can't wait to see what you're going to do with our company. Okay, so now what we're going to do is we're going to look at a live patient, and that way I can have my patient make all of those facial expressions so you can really kind of see what I'm talking about for all of those areas. So this is my wonderful patient, Brian. He has volunteered to be our model. So Brian, I'm gonna have you frown. I want you to look pissed. So what you're looking at right here is Brian is activating this entire complex. So he is activating his procerus and his entire core greater muscle groups, even the very tips of the tail. You can really see that entire group whenever he's making this face. Now remember, for a full face Botox, and you are going to be completely treating that entire complex, it is going to be 5 injection points. Your very first injection point is going to be right in the belly of procerus. So Brian, I'm going to have you go ahead and frown really hard for me. Beautiful. So I'm going to make a dot right there. Go ahead and relax. So you can see that line is right in the middle of his eyes. You want to make sure that you're not too low, because what can happen is you can have that product disperse a little bit too laterally, and so you really want to make sure you're right in the belly of that procerus. Brian, go ahead and frown again really hard for me. Your second injection points are going to be right in the belly or right at the start of those core greater muscle groups. And when Brian relaxes, you can see you're about 1 centimeter away from the eyebrow as well. Again, that's going to keep you safe. And then Brian, go ahead and frown for me one last time. And your very last groups are going to be right out here. Those are going to be in the tail of those core greater groups. If for whatever reason you do not treat all 5 injection points, just know that that patient is still going to have some movement because those tails have not been paralyzed. So Brian, the next thing that we're going to do is we're going to have you lift up your eyebrows. We're going to be treating Brian's frontalis. So remember what I talked about in the last video. You're going to have the patient look straight forward, and you're going to go in between the pupil and the lateral canthus of the eye, and you're going to go straight up. So Brian, go ahead and lift up your eyebrows for me. That first line that goes all the way across, you want to stay 1/2 centimeter above that. Another way to double check yourself is the 2-finger rule. So what I'm going to do is I'm going to mark him first. So I'm going to be right here. Go ahead and relax for me, Brian. And now I'm going to go back, and now I'm going to double check to make sure I'm in that safe zone. So I'll take my 2 fingers, and you can see I'm right where I need to be. Your next injection point is going to be your medial canthus, and you're going to go straight up. Again, in line with that first injection point as well. And then moving across the patient's forehead, you're going to go again, medial canthus, straight up. And then your final injection point will be that very lateral, between that pupil and that lateral canthus. Brian, eyebrows up for me really high. Perfect. And relax. And again, I'm going to double check myself. 2 fingers, and we're good. Now, because Brian has a normal size forehead, we are going to be doing the 7 injection points. So I will add an additional layer right at the top, because if I did not, he would still have some movement right at that hairline, and that would look kind of funny. So what I'm going to do now is have the patient go ahead and raise his eyebrows up. Perfect. And I am going to mark in between my points. So this point right up the top is in between these two. This point is in between these two, and this final point over here is just right in between those two. So now, if Brian was getting one of our toxins, he would have his entire glabella paralyzed, and then his entire frontalis as well. The next common thing is the crow's feet. So I'm gonna have Brian turn his head just a little bit. From here, you wanna make sure you're staying that 1 centimeter away. Again, because you don't wanna paralyze that lower lid. So I use the pinky rule like I had talked about in the other video. I will place my pinky right at the patient's lateral canthus of the eye, and I'm going to stay lateral of my finger. That's where all of those muscles are. That is the area that we want to paralyze, and we wanna make sure we are isolating those muscle groups that form that resting stasis of the crow's feet. So Brian, smile really hard for me. Perfect. So again, 1 centimeter out. I would do 1, 2, and then 3. Very good. Relax. So now you can see how he has these 3 injection points kind of forming that V pattern. Another tip is never cross the lateral canthus of the eye medial. Now what that means is, go ahead, Brent, look forward for me. So this is the lateral canthus of the eye. I don't want to go medial of this. That's where some of those muscles that can really impact how that patient blinks and cause that dry eye. So we want to make sure we are staying lateral of that and just isolate to those muscles that form the crow's feet there. The next thing that we're going to be looking at are the bunny lines. So Brian, go ahead and frown really hard for me. So the bunny lines that Brian has are these little riders on the nose. He doesn't have a really strong procerus muscle that's pulling down. His more just kind of pulls to the side. So he doesn't have that line, that horizontal line that you will typically see in patients where you're treating that. If he did, what I would do is I would mark on either side of it, just right there. And then that way it is a small muscle group, so 2.5 and 2.5. So now we're going to go over this entire patient's face, and we're going to see how much fluid we are putting into each of these injection points. 10, 10, 10, 10. I have pulled up 50 fluid units to go into each injection point. Now for the frontalis, it is a medium muscle group. So 5, 5, 5, 5, 5, 5, 5. There are 7 injection points with 5 fluid units in each, so 35 fluid units would be pulled up in a separate syringe to treat the frontalis. And then finally on Brian's face, looking at the crow's feet, again, a medium muscle group, so 5 fluid units in each injection point. So 5, 5, 5, 5, 5, 5. So in a separate syringe, you would pull up 30 fluid units. Now that we've talked about fluid units, let's go into what a unit actually is. So when we talk about these fluid units, that's how much medicine is going into the patient's face. The amount of units that you're charging the patient is a little bit different. What you're going to find is whenever you reconstitute Dysport at 3 mLs, it makes your math very easy. The fluid units are the same amount of the units that you're going to be charging the patient. So that conversion rate is 1-to-1. It's super easy. Now, Botox and Jeuveau, they are reconstituted at 2.5. So it does make that math just a little bit different. But what I want all of y'all to remember and kind of make your mantra is 10 equals 4, 5 equals 2, and 2.5 equals 1. Now, what in the world does that mean? That means in each of those injection points, so if I'm pulling up 10 fluid units that I'm putting into the patient, what am I going to charge that patient? So remember, 10 equals 4. So I'm going to charge that patient 4, 4, 4, 4, 4. So if this patient was only getting his glabella complex paralyzed, we would only charge the patient for 20 Botox units. However, we put in 50 fluid units. Why? Because 10 equals 4. Now we're going to go into the frontalis. So frontalis is a medium muscle group. Medium muscle groups get 5 fluid units. 5 equals 2. Remember your mantra. So I would charge that patient 2, 2, 2, 2, 2, 2, 2. Okay? And again, for the crow's feet, it is a medium muscle group, so 5 fluid units. 5 equals 2. I would charge and chart 2, 2, 2. And for the other side, 2, 2, and 2. Any of the small muscle groups, 2.5 equals 1. So if I was giving this patient an eyebrow lift, I would do an eyebrow lift just right here, and I would charge the patient 1, but I would put in 2.5 fluid units. Okay, so let's just go over that one more time. For the large muscle group, large muscle groups can handle 10 fluid units. When you're charging for Botox or Jeuveau, 10 equals 4. For medium muscle groups can hold 5 fluid units. For Botox or Jeuveau, you're going to charge that patient 2 units. And for small muscle groups, for Botox or Jeuveau, you would charge that patient 1 unit. I know that might seem a little bit confusing, but once you get into training and we really start to assess patients' faces and we go into our charting platform, you're really going to be able to become more comfortable with the 10 equals 4, the 5 equals 2, and the 2.5 equals 1. I can't wait to see y'all at training.